or Philippine Representative Dr. Rabindra Abenyasihe, Dr. Rabi. Presidential Communications Secretary Martin Andanar.
Salamat, Rocky. Magandang umaga po sa lahat ng mga nanonood sa atin ngayon at nakikinig ng live mula dito sa press briefing room. Good morning to our friends sa Malacanang Press Corps. Let me start with my opening statement. With the confirmation of 2 cases of the novel coronavirus in the Philippines, the administration assures everyone that the government is taking necessary actions to quell the spread of this contagion. President Rodrigo Roa Duterte has ordered temporarily banning the entry of any person, regardless of nationality, except Filipino citizens and holders of permanent resident visa issued by the Philippine government, directly coming from China and its special administrative regions, Hong Kong and Macau. The President will be presiding later today, the next meeting of the task force. That's going to be in the afternoon. And there will also be a press con after that. So it's open to the media. The Department of Health has released protocols in cooperation with other agencies of the government and has been providing up-to-date advisories to address the misconception and the virus and how to protect oneself from incurring such. Caution is vital, and we ask the public to consider only vetted reports and updates from the Department of Health and other lead government agencies. Meanwhile, the Department of Foreign Affairs, or DFA, has earlier said that it can repatriate Filipinos in Wuhan City back to the country for free, provided that existing rules and laws with regard to the virus are strictly observed. Mandatory quarantine, among others. In times like this, it is easy to mislead our fellow Filipinos, so we urge the public to stop spreading rumors and goading fears, as well as ending the stigma against specific nationality or race. There is no room for discrimination, and there should be none at all. Let us set aside our individual differences as we ask for a moratorium to people who want to hijack this situation and reduce it to mere politicking because lives are at stake. United in one common purpose, we will overcome this health scare. And now I turn over the microphone to Dr. Carlos of the RITM. Good morning, ma'am.
Good morning. Good morning, everybody. I would just like to give a few presentation slides on what is currently known about the virus and what our agency, the Research Institute for Tropical Medicine, has been doing to address this with the Department of Health. So we now are well aware that this is a coronavirus, and its name has been derived because of its appearance of spikes on the surface. Next, please. It causes about 10 to 30% of upper respiratory tract infections in adults, and we may have been infected unknowingly with this virus in the previous months of our lives. Next, please. The emergence of the virus actually is suspected to have arisen from some animal species, and currently being suspected are the bats population. Next, please. The spectrum of illness can be wide range from asymptomatic infection to simple cough and colds, fever and diarrhea, to pneumonias, to severe respiratory failure, and in fact to death. Next, please. There are currently 7 now known coronaviruses. 4 were previously known as human coronaviruses. Then came the SARS, MERS-CoV, and now the novel coronavirus. Next. We know that it originated from Hubei in China. Next. And just to emphasize, the age group mostly affected are on the average 55 years based on the latest publications, mostly males at 68%, and more than half have chronic diseases, notably cardiovascular and cerebrovascular diseases. Next, please. And main manifestations are fever in 83% and cough in 82%. Next. And infection is mainly acquired via respiratory droplets when an infected person coughs or sneezes. That's why it is advised that people with respiratory infections cover their mouth. Next. And the reproduction number, which basically defines the number of people that one sick person can infect, is about 2.24. So an infected person can infect around more than 2 other people in a non-immune population. Next. And no specific antiviral treatment is currently recommended, although there are many studies looking into this. Next. And treatment, therefore, is mainly supportive. If we compare the case fatality rates, these are the death rates of people who get infected in comparison with other infectious diseases, it's about 2% compared to 99% of cases of rabies, where we all know almost all people die of rabies once infected, compared to MERS of 34% and the Ebola of 39.8, or close to 40%. Next. And we have heard recently that WHO has declared a public health emergency of international concern for this infection, and Dr. Ravi can perhaps be the one to elaborate on that. Next, please. The more important steps to avoid getting sick are to prevent getting infected, and there are different ways of how to protect oneself. This has been emphasized many times by Secretary Duque: cleaning of hands, avoid touching our eyes, nose, or mouth with unclean hands or unwashed hands, avoid close contact with anyone with flu-like symptoms or colds, and avoid unprotected contact with live wild or farm animals. And of course, to protect others, we need to wear masks if we are infected. Next. There are ways of disinfecting objects and surfaces, and there have been proven agents, mainly hypochlorite solution, and there are already recommendations on how this can be prepared, which is projected in this slide. So diluted household bleach disinfects within 10 to 60 minutes from contact time. Next. And this is just a figure to illustrate how we prepare the solution from the original 5% bleach available in our department stores and groceries. And use of this may be therefore easy, since the chemical anyway is available in most groceries and supermarkets. Next. And the question of should we wear masks, this has been addressed in many occasions. And this is a poster from the WHO. Yes, we wear masks if we have respiratory symptoms such as cough and difficulty of breathing, if you are providing care to individuals with respiratory symptoms, and if you are a health worker and attending to individuals with respiratory symptoms. Currently, since there is no community transmission of the novel coronavirus in the Philippines, we are not recommending its use for the general public who do not have respiratory symptoms. Next. So this is the usual surgical mask, and we have the colored portion outward and the white portion inward. And the proper way of using that is for the colored portion to be the exposed part and the white portion towards the person. The white portion is responsible for trapping the droplets from the individual wearing the mask, whereas the outer portion, which is colored, has some resistance to water, so it protects the wearer from droplets coming from the outside. Next, please. And if we plan to travel abroad, there are certain things that it may be best to observe. We need to get enough rest. We need to update our shots, especially the flu and other vaccinations. We need to observe good hand hygiene, and we need to eat and drink from safe, clean, and reliable sources. Next. And now there are already advisories on the need for persons under investigation to be admitted. And there are 4 criteria currently employed by the DOH in order to make an assessment of whether an individual is a PUI. And these considerations are the presence or absence of fever, presence or absence of respiratory infection, travel history for the past 14 days, this time already expanded from Hubei only initially to the whole of China and its administrative regions, and history of exposure to an infected person or working in a facility caring for infected people. Next. And we have this guide tool distributed in all of the DOH facilities to help health workers make an assessment. Next. And we have certain criteria to discharge, mainly 2 negative specific novel coronavirus test results done 48 hours apart, if the patient is asymptomatic, if the lab tests are improving, and including the X-ray findings. Next, please. And now I will show some of the interventions that the RITM has been doing to help address the problem. The RITM is the Infectious Disease Specialty Center of the Department of Health. It has a 2-pronged role in responding to this outbreak, both in the management of persons under investigation and suspected patients who are infected, and for laboratory testing. We are providing the novel coronavirus PCR test to identify whether the virus is present from an individual's secretions. Next, please. So we have participated in the drafting of the guidelines on preparedness in response to this organism. Next. And continues to contribute to that. We are a member of the DOH Task Force for Coronaviruses. Next. We participate in many conferences to share information to the public. Next. And in the hospital, we coordinate with referring hospitals and the Bureau of Quarantine for patients suspected to have novel coronavirus infection. We receive patients arriving from overseas who are suspected to be PUIs, and we manage them. We do post-discharge care. We ensure that infection prevention and control measures are in place, and of course the lectures. Next. In the laboratory, we coordinate with all facilities with admitted PUIs and process and release results of tests that we do for novel coronavirus. We have coordinated with the WHO reference laboratory for confirmatory tests initially. Next. And in the long term, as part of efforts to implement universal health care, we are participating in the establishment of infectious disease specialty centers in other parts of the country, so that the skill and the laboratory facilities for infectious disease cases can be shared with other areas of the country. We are planning for surge capacity testing, and we have provided some guidance for upgrade of DOH hospitals. Next. So that will, there are plans also to use an electronic tool to link EPI and lab data for risk assessment and assist in the procurement of reagents for our regional laboratories. I think that's the last. Next. Yeah. And of course, to comply more closely with international health regulations, these are standards which countries must comply with in order to be able to address properly any events such as infectious disease outbreaks that we are facing nowadays. Thank you very much.
Thank you, Dr. Carlos. Salamat po. Our next speaker is the spokesperson of the immigration. Ma'am Dana.
Thank you, Sec. In behalf of the Bureau of Immigration, Commissioner Jaime Morente, good morning to our colleagues from the government and the WHO, as well as our friends from the media. This is to give you a rundown of the actions of the BI to help fight the 2019 novel coronavirus. As early as the 4th week of January, all BI frontliners were required to wear protective masks to prevent the spread of the 2019 nCoV at the airports and seaports. The Bureau of Quarantine has likewise conducted pocket trainings for frontline airport personnel on protecting themselves from the virus. Last January 23, we have assisted the Bureau of Quarantine by providing information on PUIs. The following day, January 24, the BI has started denying applications for visa upon arrival for Chinese nationals coming from Wuhan province following the temporary cancellation of the Civil Aeronautics Board of all direct flights from Wuhan City to the Philippines. On January 28, the issuance of the visa upon arrival for Chinese nationals was suspended in an effort to slow down the arrival of Chinese tour groups. By January 30, despite not receiving any directive regarding travel bans, all frontline personnel were instructed to conduct prudent assessment of passengers and refer passengers who came from Hubei province to the Bureau of Quarantine for checking or double-checking. On January 31, talks about the possible repatriation of Filipinos in China started. Hence, the BI created a special team of inspectors to conduct immigration formalities for them. On February 1, the BI implemented a ban on foreigners from Hubei province following an order from the President to stop the entry of all visitors from Hubei. Notices were likewise sent to airlines and shipping agents requiring them to screen passengers before boarding to restrict the arrival of passengers who have visited Hubei province in the last 14 days. Yesterday, February 2, the President ordered an expansion of the travel ban to include the entire People's Republic of China and its special administrative regions, which are Hong Kong and Macau. The BI immediately implemented this and, following the President's orders, advised all stakeholders that all foreign nationals, regardless of their nationality, who will be coming from China and its special administrative regions, shall be turned back and not allowed to enter the Philippines. However, Filipino nationals and Philippine permanent resident visa holders will be allowed to enter, subject to a 14-day quarantine to be implemented by the Bureau of Quarantine. Other visa holders and transiting passengers will also be denied entry. The ban includes passengers who have been to the areas of concern in the last 14 days. The BI has also sent a notice to airlines and shipping agents requiring them to screen passengers before boarding to restrict the arrival of aliens who have visited China, Hong Kong, and Macau in the last 14 days. Also part of the ban is the departure of Filipinos going to China and its special administrative regions. The ban does not specify exemptions. Hence, all Filipinos, regardless of visa type, will be barred from traveling to China and its special administrative regions temporarily. The BI urges everyone to temporarily refrain from unnecessary travel and bear with the government as this measure is implemented. Commissioner Morente is appealing to the public, asking everyone to work hand in hand to ensure that the country is protected from this virus. Moving forward, the BI is ready to implement further policy changes relating to foreign travel as deemed appropriate by the Department of Foreign Affairs or the Office of the President as recommended by the Department of Health. Thank you.
Thank you, Spokesperson Dana. Now to our DFA Undersecretary, Ernie Abella.
Morning. The Department of Foreign Affairs continues to monitor the coronavirus outbreak and ensures protection of overseas Filipinos and the well-being and protection of the local population. No Filipinos in China are confirmed to be infected with the 2019 nCoV acute respiratory disease. None. There are 295,047 Filipinos in mainland China. The Philippine Embassy and 6 Philippine consulates general in China continue to issue timely advisories through the official website and social media like WeChat. All FSPs or Foreign Service Posts have dedicated 24/7 hotlines that Filipino nationals can call. Public advisory providing hotline numbers for Shanghai Consulate General in Hubei Province. Hotline numbers of Philippine Embassy in Beijing, Chongqing, Guangzhou, Hong Kong SAR, Macau SAR, and Xiamen. Contingency plans of all China Foreign Service posts are continually updated to reflect realities on the ground. Second, the DFA announced Friday, 31 January 2020, an advisory calling for the voluntary repatriation of Filipinos in Hubei in China. They are to contact the Consulate General in Shanghai by today, the 3rd of February. The aircraft may leave for China sometime this week. A rapid response team from DFA UMWA, along with 5 to 7 medical personnel from DOH, may be deployed to fetch the Filipino repatriates. DOH has drafted guidelines for the repatriation. Third, DFA imposed on the 2nd of February 2020 temporary suspension of visa issuance to travelers from China and its special administrative region effective immediately. Temporary suspension of visa issuance is also extended to foreign nationals who, within the past 14 days immediately preceding arrival in the Philippines, have been to China and its SARs. This is on top of the previous announcement temporarily suspending visa issuance for travelers coming from Hubei province. End of update.
Thank you, Yusek Ernie. Our last speaker before you can ask questions is the representative of the World Health Organization here in the Philippines, Dr. Rabi.
Thank you, Secretary Martin. Good morning, everybody. WHO has been working with the Philippine government since the announcement of outbreak of pneumonia of unknown etiology that was officially communicated by the National Health Commission of China on the 31st of December 2019. We have worked closely with the authorities in China, and the Chinese authorities have prioritized the response to this outbreak. Their efforts have contributed to us gaining significant knowledge on this particular outbreak. They have contributed to identifying the pathogen that caused this outbreak of pneumonia initially in the city of Wuhan, which is now known as the 2019 coronavirus. Subsequent to that, by about the 10th of January, a diagnostic test for detecting this pathogen was developed, and this has also been shared through WHO with member states. This has facilitated the ability of many countries, including here in the Philippines, to conduct locally diagnostic tests. WHO has been closely monitoring the evolving of this outbreak and has been concerned about the emergence of this new pathogen. Because of this concern, our Director General summoned the Emergency Committee of the International Health Regulations on the 22nd of January, whether to consider the evidence and decide whether this event needs to be classified as a public health emergency of international concern. The committee could not reach a consensus on the 22nd and was reconvened on the 23rd. And they decided that based on currently available evidence on the 23rd, it did not warrant to be classified as a public health emergency of international concern. However, the committee, at the request of the DG, expressed their willingness to reconvene at short notice, and based on further emerging evidence, the committee was reconvened on the 31st of January, and at these deliberations, based on new evidence that had emerged since the 23rd of January, the Emergency Committee of the International Health Regulations, a panel consisting of experts, independent international experts, recommended to WHO the classification of this event as a public health emergency of international concern. Let me clarify what that would mean. The classification of the event as a public health emergency of international concern provides WHO the opportunity to better coordinate an international response, mobilizing resources of all member states to address this challenge. The committee and WHO continues to believe that this outbreak can be controlled and the spread of the virus can be stopped. WHO is working together with member states to strengthen their preparedness capacities, to improve their ability to deal with possible or likely importations of cases, and to better manage those cases. WHO commends the actions taken by the Filipino government to strengthen its preparedness, to build capacity to detect cases, and WHO continues to work together with the Department of Health Philippines and the Filipino government to increase its preparedness and response capacities to deal with this outbreak. We remain confident that the outbreak can be controlled and we can prevent expanded spread of this disease. To date, there have been more than 17,000 cases reported. The vast majority of the cases continue to be reported from the People's Republic of China. The outbreak has also unfortunately resulted in the death of 362 people, all of them in the People's Republic of China, excluding the one death which happened on Saturday here in the Philippines. The disease has now been reported from 23 countries, several of those countries also reporting local transmission, although most of the cases that those countries have reported had a travel history to affected areas in Hubei province, particularly to Wuhan. WHO reiterates that WHO has made available and is mobilizing all resources in its capacity at country office level, in the region and globally to address this emergency of international concern. And we will continue to work with the Department of Health Philippines and the government of the Philippines to increase your preparedness and response capacities. WHO is confident that at this point of time, there is no community spread of the disease as per evidence that is currently available within the Philippines. We want to reiterate that the 2 cases that have been reported here in the Philippines were both from travelers who originated from Wuhan, who actually traveled with early signs of the disease. So we commend the government of the Philippines for the measures it's implementing, and we work in partnership with them to strengthen their response capacities. Thank you.
Thank you, Dr. Rabi Abayasing. Thank you, Dr. Celia Carlos, Yusek Ernie Abella, and Bureau of Immigration spokesperson Dana Sandoval. I turn over to Undersecretary Roque Ignacio for the press conference.
Okay. Question. Raymond Tinasa, then Mela.
Good noon, ladies and gentlemen. Kay Secretary Andanar siguro. Now, yung papatuparin o pagpatupad ng temporary travel ban, kasama ba dito ang, for example, yung mga, may concern kasi yung mga doctors from US who are planning to travel for a medical mission sa Guimaras. Nagtanong sila kung kasama ba sila kasi meron silang layover or stopover sa Hong Kong and mainland China, then back then to Manila. Kung kasama ba sila sa ban sa entry sa Pilipinas?
If they are part of the delegation po Hello there. If they are part of the delegation of the WHO and government efforts in combating the virus, then they will be allowed to enter the Philippines.
No, I mean, not necessarily part of the delegation of the WHO, but only doctors, regular doctors from US who are traveling to the Philippines, but they have a layover or stopover in Hong Kong and China. So they are part of the affected to be barred entry.
Doon po sa directive na natanggap natin from the Office of the President, all Filipino nationals po. So, lahat po ng dadating na Pilipino are subjected to the assessment of the Bureau of Quarantine. They will also not be allowed to depart the country.
Yung not necessarily Filipino nationals, say US nationals or European nationals who are coming to the Philippines, but they have a scheduled layover or stopover for 4 to 5 hours in the airport, then flight to Manila.
Even transiting passengers po, basta bumaba po ng Hong Kong, mag-layover po sa Hong Kong, mag-transit, they will still not be allowed to depart, to enter the Philippines.
Kay Undersecretary Abella, sir, now that umiiral na yung temporary travel ban and our local aircraft or airplanes, PAL and Cebu Pacific, already canceled or suspended flights to and fro from China to their SARS. Ano yung magiging arrangement for yung aircraft nila? For example, from Wuhan or from Hong Kong or from kung wala naman ng bibiyahing airline?
Tulad ng report kanina, inaareglo ng gobyerno natin na may mapadala tayong aircraft na patungo sa affected areas na yon. So, ang expected po ay sometime this week. Yun ang target date, makarating doon para i-ferry back yung mga nag-volunteer na magpaparipate.
Thank you.
Okay, Mela, then Maricel, and Saliman.
For Ms. Dana of Bureau of Immigration. Hi, ma'am. I know it was already mentioned earlier, but just to reiterate, since there are so many criticisms, it was January 31 when WHO declared the 2019 nCoV ART as a public health emergency of international concern. Prior to this declaration, do you think the Bureau of Immigration make necessary or enough actions to quell the spread of the contagion?
Yes po, we believe so po kasi we work with the recommendations of the Department of Health and we cannot implement policy changes with regards to travel ban unless directed by the Department of Foreign Affairs and the Office of the President. So lahat po yan, we take into consideration the recommendations of the Department of Health, which is based on the recommendations of the World Health Organization.
And last one question na lang, ma'am. China declared human-to-human transmission of the nCoV on January 20. Then Singapore, with 13 confirmed cases of nCoV, banned travelers with recent visit to China on January 31. The Philippines, with 2 confirmed cases, made a similar ban on February 2. For BI, do you think government response is just right, or is it late as alleged by some critics?
We believe po that it's just right kasi like I said earlier po, naka-ankla po tayo on the recommendations of the World Health Organization and ang ating Department of Health is equipped in assessing the situation and the needs of our country kung kailangan po natin ng travel ban. So yung naging response po natin is appropriate naman with the recommendations of the World Health Organization.
Okay, thank you. Maricel?
Yusek Abella or Secretary Andanar, good morning. Sir, what will happen to those OFWs who are just here in the Philippines for vacation? Will they be allowed to go back?
Temporarily po, due to the travel ban, hindi po muna because wala pong distinction between visa types dun sa lumabas po na direktiba dun sa travel ban. So lahat po ng Filipino nationals who are in the country will not be allowed to depart for the Hong Kong, China, and Macau.
But given that situation, since yun po kasi yung source of income nila, of course, so I understand some of them are are concerned what will happen to their jobs in China or in Hong Kong or in Macau. What's the plan of the government for these OFWs?
We fully understand po because kung yun ang talagang kinabubuhay nila. But I believe po the POEA and the OWA will be doing their part po in ensuring na itong mga trabaho po nitong mga ating kababayan abroad ay mananatili despite this travel ban.
Ma'am, just a clarification on the quarantine of Filipinos who are coming back here. Paano po yung magiging procedure nun? Dun sa mandatory quarantine, talagang self-quarantine lang yung gagawin sa kanila?
It might be best po for the Bureau of Quarantine to answer this question because they are the ones po who are implementing the quarantine. In immigration po, we process the documents of the person and the person itself. But when it comes to health matters upon arrival, it's really the Bureau of Quarantine.
Okay, thank you
Okay,
po.
Salima.
Hi, to Dr. Rabi of the WHO. Sir, can we just get the reaction of the WHO to news coming from Thailand that a certain cocktail of antivirals used to treat flu and HIV is used to treat nCoV patients, and apparently there's one who had a dramatic improvement. What do you know about this?
Thank you for the question. We've seen media reports of this. As you know, the declaration of a public health emergency of international concern also encourages research into better managing patients and looking for treatments and preventive interventions such as vaccines. So we encourage evidence-driven efforts in that direction. We've seen reports coming from Thailand. Of course, the improvement of one patient does not constitute evidence. WHO will work more closely with the authorities in Thailand, but also we are continuing to work with the authorities in China and with other research institutions to build evidence of what practices should be adopted by affected countries to improve case management, to prevent the transmission. And no sooner there is clear evidence of what works, WHO will share that. In the meantime, WHO has shared interim guidance with member states on how to prevent and control infection, how to manage cases, and how to do diagnosis of suspected patients through lab testing. So we need to recognize that this is an evolving situation. It's a new disease, and WHO remains committed to working together with the global research community to generate that evidence and share it with member states when available.
Okay. Sir, right now what we know is that transmission is through droplets, respiratory. But in the US, I understand there was a patient where they found the virus in the stool sample. What do you know about this, and is this alarming?
So we know that the virus will be contained in body fluids, and usually it being a respiratory disease, the commonest mechanism of transmission from symptomatic individuals is through sneezing and coughing when droplets containing the virus are either absorbed by somebody in close proximity or rest on some surface which then becomes a fomite, an infected surface, the touching of which could help transmit the disease to somebody else because you touch where the place where the virus is and then touch your eyes or nose or mouth and the virus can enter you. So that's the common mode of transmission. But it's not unknown that coronaviruses can cause intestinal side effects, and so reports that viruses are contained in the feces are not entirely unexpected, but we do believe that that's not the primary mode of transmission of this outbreak. The reports of the presence and possible implications for its transmission through fecal-oral routes are being investigated but not as yet confirmed by WHO.
To Dr. Carlos and maybe Secretary Andanar, given na wala pa naman po talaga na kumakalat sa mga Pilipino, wala pa pong community spread, ito pong nCoV. Pero yun nga po that posible pa rin naman through fecal matter kumalat yung mga ganito pong klaseng viruses. How are you reacting to this? Kasi nga, given na maraming Pilipino po, ang wala pong mga sarili po nila mga toilets.
Firstly, there are other coronaviruses previously identified, like nCoV, in which there was proven a virus excretion through the feces. So it may not be surprising that the same thing will be later evident from the novel coronavirus. So what do? We need to strengthen advice to the public to practice oral and proper food hygiene, to wash their hands well before and after eating, before and after using the toilet, which is not really common. Because we see many Filipinos using the toilets without washing their hands before and after. So we need to strengthen that information. And we need to be careful about disposal of feces. They should be properly contained and put in the proper waste disposal bins, especially for areas where there are no established sewage systems. So I think for now, those are the recommendations, especially in areas where there are no established sewage systems.
Secretary Andenar, would you know po if meron tayong quarantine facility na sabi nila Magsaysay or in Caballo Island? Ano po ba yung balak po gawin doon? Lalo na po doon sa mga babalik po ng mga Pilipino from those countries po.
Ang sinabi po ni Secretary Duque is they're considering Fort Magsaysay kasi nga sa laki ng facility at pwedeng i-quarantine doon kahit na ilang daan o libong pasyente. 10,000 yung actually capacity ng Fort Magsaysay. Pero yung sa Visayas and sa Mindanao, bukod dun sa mga ospital ng ating Department of Health, wala pang nababanggit sa akin si Secretary Duque kung saan i-quarantine yung mga possible carriers itong nCoV. But later on, we have an emergency meeting with the President, and after that, we will have a press conference. So, baka pwedeng itanong mo ulit dun sa... merong dagdag po si Dr. Carlos.
In the interagency meeting last Friday, the plan was for a team from the DOH, from quarantine, from immigration, DFA, to visit the prospective facilities. That includes Fort Magsaysay. So depending on the findings, the decision will be made on where to quarantine the returning Filipinos.
Pero po, nagsimula na po silang bumalik. Kahapon po tayo nag-start nung atin pong issue ng temporary ban. So syempre po yung mga nakabalik po mga Pilipino, although alam nilang may self-quarantine, hindi po nila alam kung saan sila pupunta, kung ano po ang gagawin. Hindi po kasi malinaw yon sa public na, kunwari ako po, dumating ako, babalik po ako sa pamilya ko, at sasakay po ako ng bus, sasakay ako ng taxi. So yung ganun pong pag-aalala, paano po ba natin yun makokontrol?
So far, ulitin ko lang po yung sinabi natin kanina na yung proposal po yung wala pa pong nabalik mula sa Wuhan at sa Hubei province.
Pero po sir, yung mga galing China, Hong Kong, Macau, syempre po kabado po sila ngayon. Bumalik po sila kahapon. So ano po yung instructions natin sa kanila? Paano po tayo magsa-self-quarantine? Paano po yung proseso?
The decision tool earlier in my presentation, and there's a part there where if personnel returning from China have no symptoms, no fever, no respiratory symptoms, just a history of travel, they need to do self-monitoring at home. So they stay at home, preferably separated from the rest of the household. If they can stay in a separate room, that's much better. They are advised to wear masks for around 14 days from arrival, from the date of arrival, until they complete the 2 weeks. If they have no symptoms, then that's it. But if they develop symptoms, they are advised to go to a facility which can evaluate them. So that's the general instruction.
Okay, thank you, Salima. Can we have
And sorry, to monitor their temperature twice a day.
Okay. Can we have our friend from? Please state your name. Microphone, please.
Hello, I'm Sarah Gomez from International News Agency FM. My question is for Bureau of Immigration. I would like to confirm some reports I've read this morning about that some hundreds of foreigners, including 300 Chinese nationals, stranded in the airports. I don't know if all of them are in Naya. Apparently, right now, they weren't allowed to get into the Philippines, but now they can leave because there are no flights available. Can we confirm that figures and to know what would happen to them?
Yes, that's true. There are around 300 Chinese nationals who are stranded in NAIA because most of the airlines have canceled their flights already to and from the different parts of China. But our office is coordinating with the Chinese embassy, and they have pledged to send an aircraft to fetch their citizens who are stranded in the country. And maybe today or in the next few days, we'll find out the details of this flights that the Chinese embassy will be arranging.
And where are they now?
Currently, they're still at the NAIA.
There's
Yes.
a specific area in the
Yes.
airport? They are only Chinese, or there are also foreigners from other...
There are also other foreign nationals, but most of the ones that were stranded since yesterday have already departed.
And I have another question for Undersecretary Abella. Can we know, I don't know if, can we know when can we expect the arrival of the Filipinos repatriated from China? And I don't know if you have an idea of how many of them will be had already requests to be repatriated to the Philippines.
All right. As of an hour ago, 45 minutes ago, we found out that about 40 Filipinos have already requested to be repatriated. The expected goal is to be able to fetch them within the week. That is the intended goal. So,
40?
40, yes. Thank you. From Wuhan, Hubei province, yes. Thank you.
Thank you, sir.
Okay, Tuesday New.
Kay Ma'am Dana po. Hi, Ma'am. Nababanggit po kanina mayroon ng 23 countries na affected ng coronavirus. Pero nakakonsentrate lang po tayo ng travel ban sa China, Macau, at saka Hong Kong. Yung iba bang bansa na affected na rin ito, like Taiwan, for example, Malaysia, mayroon na rin recorded, Singapore, wala ba tayong i-impose din na travel ban dyan sa mga, safe ba tayo sa mga dumarating na citizens nila or other nationality coming from that countries papunta rito sa Pilipinas? Or tayo naman ipupunta din sa kanila?
Siguro po kung may changes in policy dito sa ating travel bans, if there is a need to expand it, it will be recommended po by the Department of Health and the World Health Organization.
Yeah. Ang concern lang, ma'am, is baka masyado tayong nakakonsentrate sa China, Macau at Hong Kong. Baka malusutan naman tayo dito sa iba pang other countries na affected na rin pala nitong coronavirus.
Yes po, we believe naman po that the capacities of our Department of Health, also the World Health Organization, is enough naman po to guide the President and our other government agencies in crafting changes in the policies po dito sa travel ban.
Okay, thank you.
Thank you.
Francis, microphone please.
Good morning po, sirs, ma'am. Ma'am, Sir Andenar, tanong ko lang, nagkaroon po ng komento si Vice President Leni Robredo about sa hindi raw maayos sa pagbibigay ng impormasyon ni Secretary Panelo about the coronavirus. Ngayon, in-encourage na si Presidente Duterte na as the head of the government na siya po ang lumabas sa publiko, magbigay ng update para at least ang mga tao po mas mapanatag sa nangyayari ngayon sa atin. With regards sa virus po, ano pong komento ng palasyo dun, sir?
We respect the suggestion of the Vice President. Mamaya meron tayong emergency meeting with the President at exactly pag-uusapan itong 2019 and coronavirus. Then after which, there was a press con, so you may ask the President later on. Thank you.
Okay. Rosalie, then yellow.
Good morning po. Kay Miss Dana po. Ma'am, may exceptions po ba dun sa travel ban? For example, meron pong nakascheduled na operation sa China or kaya sa Macau and Hong Kong, and pati po ba yung mga diplomatic personnel ay exempted dun sa travel ban to China?
Yung mga Filipinos po that would be departing the country, wala pong exemptions na nakalagay doon. But of course, for such reasons po, if there is really a health emergency, maaari po siguro through the recommendations of the Department of Health din. Kasama din po yung isa pong question na nag-emerge yung mga dual citizens, kung maaari po ba silang umalis ng bansa, given that they are both Filipino and foreign nationals. Sa atin po, we allow the departure po upon presentation of the foreign passport.
Pwede rin po bang makuha yung bilang kung ilan na po yung hindi po pinayagan na makapasok ng bansa? Mga Chinese and foreign nationals na nanggaling sa China and other special administrative regions.
Sa ngayon po, we are still collating the figure kasi the directive just happened yesterday morning. So kinokolekta pa po natin yung figures. But perhaps in the next few days po, we will be able to give you a more concrete number.
Last na lang po. I-clarify ko lang po yung naging statement nyo kanina dun sa mga OFW na hindi makakabalik dahil sa travel ban. So ang OWA ang magbibigay ng assistance. What particular assistance po?
Siguro po, coordination with their agencies para po maprotektahan yung kanilang trabaho bago pa po sila makabalik sa bansa. Given the situation, I'm sure everyone understands that each country has been conducting their own restrictions when it comes to travel because dito nga sa kumakalat na sakit na ito. So I'm sure that people will understand that that we are doing this, the government is doing this for the protection of everybody.
Okay, Ms. Yellow, then Pia and Ace.
Morning. Yellow from China Central Television. I have a question to Secretary Andanar. Because yesterday I saw a post by Ambassador Chito Romana in his Facebook, and he posted a song written by Filipinos living in Wuhan. And in this song, these people said, I hope I'm pronouncing it right, Pangong Wuhan dayong magkasama-sama, Pangong Wuhan dayong magkakaisa. So this kind of song encourage people in Wuhan and around China very much. So I would like to know from the Philippine government, do we have any message to Chinese people and especially to these Filipino who choose live in Wuhan? Thank you.
Thank you for that question. In fact, I have seen several videos online of Chinese people chanting that specific song that you were saying. Yesterday, we did release a statement against discrimination, that we should not discriminate people, especially Chinese, who are affected by this coronavirus. This is not the trait of the Filipino. It should never be the trait of a Filipino. And we did mention also that there were several times or numerous times that we were in need, and countries around us like Singapore, Malaysia, China, even the Americas and Europe were there for us. So we should be also there for the Chinese people who are suffering this coronavirus in prayer and also in support. There should be no room for discrimination. I will be asked. Do you have an answer for that? Kung meron. Okay, so later on I have a meeting with the president, and we will ask the president what his message is to the Chinese people. Thank you.
Thank you. I have another question to Dr. Rabindra from WHO. You just mentioned that all the states need to work together to prevent this kind of transmission of the virus. So I would like to know some comments from you about how do you see Chinese government's actions, like they lock down quite a lot of cities to prevent the spread of the virus, and Chinese government built a hospital in 8 days to contain a lot of people there. So I would like to know from the WHO side. Thank you.
Thank you for the question. WHO acknowledges the proactive role that China has played right from the beginning of this outbreak, transparently sharing information as it becomes available, sharing knowledge, the identification of the pathogen per se, defining its whole genome sequence, sharing that and sharing diagnostics. Also sharing information about the clinical presentations, the manifestations, and how the patients are managed. All of that has been valuable in helping WHO better understand this disease. So as our Director General mentioned, when he met President Xi Jinping, we are very appreciative of those efforts of the Chinese government. We also are encouraged by the measures China is implementing to contain this outbreak, both in Wuhan and Hubei and within China, but also from spreading to other countries. WHO acknowledges and is monitoring closely China's efforts to lock down approximately 50 million people now to contain this outbreak. As WHO has mentioned, this is unprecedented in global public health, and we are closely looking at its effectiveness and what its relevance would be for future global efforts in containing these kinds of epidemics. We also appreciate the early efforts implemented by the government of China in implementing a travel ban for tour groups to travel abroad, and in early implementation of exit screening to screen patients leaving China. These are important experiences that WHO is trying to understand and see what is replicable and good, so that we can learn from these experiences on their potential usefulness. And we continue to work both on the ground in China with your specialists to better understand what is necessary to control this disease and to help control the disease in China.
Thank you so much, sir. Last question to anyone who can answer it, because we just mentioned in the press conference that there's no local transmission here in the Philippines yet. But what the government prepared to do in case this outbreak will happen in the Philippines, because maybe we will face some shortage of the equipment like face masks, and especially like the doctors and the nurses in the hospital, their equipment maybe face a shortage. So I would like to know how the government will do in face this.
Based on our recent meetings in the Department of Health, as early as now, there are efforts to procure huge amounts of personal protective equipment, not only from local sources, but even from international sources, in anticipation of a possible wider spread of this coronavirus. And of course, we are still at the containment phase, which means there's no community transmission. That's why a huge amount of effort is currently being implemented to identify possible people who may transmit the disease. As you know, there is contact tracing of the persons who were found to be positive, and that's not a small amount of effort. You identify all the possible contacts of that patient, you assess their health condition, you treat them, or you quarantine them if necessary. So those are really very huge measures being undertaken to avoid the transition of the country from simple containment to mitigation. So hopefully we will not reach that particular stage.
Okay, we still have, thank you. Yeah, we still have Pia, Ace, Mikael, Chona, and Alvin.
Okay, Dr. Carlos po, as a follow-up to the question of Ms. Yellow, you mentioned a while ago that the RITM is preparing for a possible surge of people that you need to check whether they have the coronavirus. Could you tell us more about your preparations, ma'am?
We have a surge capacity plan for training subnational laboratories to be able to do the test. But since we just acquired the technology fairly recently and started testing Thursday last week, we may need to, first make an assessment of 5 subnational laboratories previously identified. In fact, we have been training them for influenza surveillance since almost 5 years ago. And the test for coronavirus uses the same test format. So it will not be difficult. We just have different reagents and different primers. So we have that plan, and in the last command conference of the DOH, there were already measures laid out on how they can be provided capacity to do the test.
So in the future, ma'am, we may be able to activate 5 more laboratories for the testing?
Yes.
Okay. Ma'am, follow-up lang din po dun sa, or just to clarify yung nabanggit nyo po kanina, returning Filipinos from China, if they do not manifest any symptoms, ang meron lang sila is a travel history to China, they can self-quarantine. But what about those coming from Hubei province or Wuhan po?
I think the same recommendations hold. The decision tree is clear. If you have no symptoms, you just have an exposure to, by travel, then you can do just self-quarantine.
Kaya Ms. Dana po. Ma'am, ito po, is that being explained in depth dun sa mga bumabalik po na Filipinos from China?
Yes po, we are in close coordination with the Bureau of Quarantine, who does the explanation po when it comes to the pagka-quarantine po nitong mga dumadating natin na OFWs. So they are advised po kung ano yung mga kailangan nilang gawin, and then sila din po yung nagsasabi kung ano yung step-by-step na dapat gawin at kung saan po magre-report kung sakali pong makaramdam ng any symptoms of the coronavirus.
Ma'am, ano pong ginagawang basis ng Bureau of Immigration to verify kung totoo yung sinasabi na travel history ng isang tao?
Passports po. Makikita po yan sa passports kasi kasama po dito sa travel ban is not just yung pinanggalingan niya but the travel history within the last 14 days. So makikita po sa passport kung saang bansa po nanggaling. So if within the last 14 days, the person, the foreign national came from Hong Kong, China, or Macau, automatic po we can deny this the entry of this person. At the same time po, nagpadala na rin po tayo ng advice sa airlines, pati po sa mga shipping agents to pre-screen the foreign nationals that are boarding their vessels to make sure na hindi na po makasakay at itong mga foreign nationals na to para po maiwasan na kailangan pa natin silang ibalik. And pre-screening po really is to the advantage of the company dahil hindi na po nila kailangan ng added cost para ibalik pa po yung taong ito since automatic disqualified naman na po yan kapag pumasok sila sa bansa.
Last na lang po kay Secretary Andanar. Sir, what do you say to criticisms na yung emergency meeting later ay masyado nang late considering na last week pa po na report yung first death from coronavirus in the Philippines?
No, it's not late. In fact, very timely ang decision ng gobyerno. Again, we follow also the directives and also the recommendation from the World Health Organization, the Department of Health. Again, I would like to reiterate na itong namatay na infected by the coronavirus is a person from China. At yung infected din yung kanyang kasama. Wala pang Pilipino. Thank God na infected nito. Yung desisyon naman ng gobyerno ay very methodical. At yung meeting mamaya ay nataunan din na timely because nung weekend namatay yung pasyente na galing pan China and unfortunately the first death outside China.
Sir, sino-sino yung mga kasama dun sa meeting and what can the public expect dun sa outcome ng meeting na yan?
Hindi ko masagot kung sino-sino because I was also just informed. Pero ang nakalagay doon, Pia, is select number of cabinet members. So meaning hindi lahat.
Thank you, sir.
Okay, Ace and then Mikhail.
To our officials, just curious because the first death, confirmed, the first death in the Philippines is the second confirmed case of nCoV. Tama po. Okay. But when the DOH and the government announced the first case of the nCoV, there was no mention of the 44-year-old Chinese man who is already suffering from the disease. May we know why there was no announcement regarding the second case of the nCoV?
I was in the press con when Secretary Duque announced the death of the first case, and he did mention that the first case had a companion, male companion, who was also sick. But at that time, the male companion was not as ill as what happened in the subsequent days. So the illness progressed subsequently, which eventually led to his demise.
Okay, so when he was ill, it was not yet nCoV. It was not yet a confirmed case that time.
It wasn't confirmed.
Okay.
His confirmation came later.
Later. So it just deteriorated fast.
Yeah, his condition deteriorated in the last 24 hours.
Okay, do you have any information as to how many people have interacted or had interacted with the fatality?
This, of course, will be the health personnel attending to him, and the people perhaps who were exposed during their travels because they traveled to different places in the Philippines. And that is now being investigated by the Epidemiology Bureau.
Okay, thank you po.
Okay, Mikael? Microphone, please. Alvin, paabot ng mic.
Hi, good morning, Dr. Carlos. Mikael Flores of AFP News Agency. Ma'am, just to clarify on the timeline of the 2 confirmed cases, because DOH announced the first confirmed case on January 31, and then the first mortality was announced yesterday. Why was there a 2-day gap between the confirmation of the cases? When did you actually confirm that the second confirmed case is nCoV? Because it turns out that the 2 are a couple from Wuhan. So why were they not tested at the same time?
The sample from the first confirmed case was sent to Australia, and the sample from the second case was, although sent just last Friday, we had the results done. We had the testing done already at RITM by the time. So the official results from the second case was sent out last Saturday morning only. So the results of the first confirmed case came earlier because that was sent to Australia.
Ma'am, just to clarify, the second confirmed case was confirmed already by our RITM because we have the capability already.
Yes.
Ma'am, why did the government not send both samples to Australia? Why did you just decide to send the sample of the first case?
We sent actually the sample to Australia of the second case last Friday, and we're waiting for the results, which may probably come anytime soon. So since we had the capability already for testing Thursday last week, we decided, of course, to process the sample of the other PUIs sent to us. And we had that result. And just to make sure that perhaps we were doing the right thing, we also processed in parallel the sample from the first confirmed case, which was positive, and we had the same results. So the staff was confident that our procedure was correct.
Ma'am, can you give us an update of I think we have around 36 POIs and 4 are undergoing testing. Can you give us an update if if the 4 remaining cases have turned out to be positive or negative, and do we have additional POIs as of today?
I don't know about the additional PUIs because that's within the database of the Epi Bureau. The question should probably be answered by the Epi Bureau people. But as to the rest, so far with the results sent to me for approval, there has been no positive results to date.
Ma'am, why did you
after the second positive?
Ma'am, just to clarify, you already knew on Saturday that there's a second confirmed case. Mm-hmm. Ma'am, why did you decide not to announce that on Saturday, and why did you announce it just yesterday?
Well, we sent the results to our superiors, and it was the decision above which, it was them who decided when to call for the announcement. But that was late Saturday already, so perhaps there was not enough time to gather people to make the announcement on the same day.
Ma'am, around what time did was the patient pronounced dead? And was the confirmation before the patient died or after the patient expired?
The confirmation came before.
Came before. Ma'am, around what time namatay yung pasyente? If you
I am not aware of the exact time of death. But it was Saturday.
To Ms. Dana, can you clarify on the Chinese who are currently in NAIA? Where did they come from and where exactly in NAIA are they currently held?
This is collectively, so they are not bunched up together in one terminal. So I would have to get the details kung saan sila galing, but most probably within the China and the special administrative region. That's why they were caught in limbo and at the airports. But like I said earlier, the Chinese embassy has already coordinated this with our office and is planning to send special flights to fetch their nationals.
Okay, thank you, Mikael. Excuse me. Can we have Alvin Baltasar? Okay, it's a follow-up question. Yes, please. Please use the microphone, please.
Regarding the passengers stranded in the airports, I think it's not just Chinese. Is the biggest number. With what would happen with the others? I think there are also Americans.
Most of them were able to depart already.
So right now it's mainly Chinese.
Yes,
the ones
most
stranded there.
most of the ones who were stranded yesterday were able to depart already.
Okay, thank you. Alvin, then Chona.
Dr. Carlos, magandang good morning po. Doktora, here ma'am. Doktora, how can we assure the safety of the patients, pati yung mga health workers na naka-assign sa San Lazaro Hospital? Pati na doon sa mga ospital na kung saan mayroong mga patients under observation.
For San Lazaro and RITM, we have set standard procedures on infection prevention and control. And that covers a lot of things from the wearing of the personal protective equipment, to handling of patients, to cleaning of rooms occupied by infected patients, and so on. So both of the hospitals have a long history of handling emerging infectious diseases. And so far, we have been good. The health workers have been, none of them so far have been infected.
Doktora, dapat lang ba na magbigay tayo ng additional or recommend na magbigay ng additional hazard pay doon sa mga health workers na naka-assign sa mga patients?
In addition to the previous answer, we also request our health workers to monitor their temperature twice a day. And then we quarantine them in case they develop any symptoms, and we manage the symptoms. Your question is about the hazard pay. I think
additional,
that would be good. But it's not within my power to determine whether that should be given. But if that is recommended, I'm sure all of us will welcome that, especially from RITM and San Lazaro.
Will you recommend, ma'am?
Of course.
Okay.
Although we have a standard hazard pay in government, but there are people who are exposed to more hazards than others, but they receive the same remuneration.
Thank you, Alvin.
Just a point of clarification regarding the earlier question about the 300 Chinese. The number does not just include those who are at the airports right now. It also includes the Chinese nationals who are in the country who want to go back to their homelands already. So it's not just the ones at the airports, but it includes all those who are in the country who wants to go home now. I'm sorry? Not only in Manila.
Okay, thank you. Chona?
Ma'am, any update on efforts of the government to track down yung people who got contact dun sa one couple?
The Epidemiology Bureau staff have the updated information. I'm sorry, I don't have the updated information.
And ma'am, dun sa RITM, may mga test sample pa ba tayo na hinaantay from Melbourne, Australia? Wala.
We sent 3 samples from 3 patients, so we're awaiting that.
And those samples are from people who came from China also? Wuhan?
Yes, from China.
Thank you, ma'am.
Okay. Can we have our friend from? Yes, please state your name.
Hi, good morning. Joanna Balyaran from GG Press. Ma'am, Dr. Carlos, my question is, how do you ensure that passengers will follow self-quarantine procedures? Does the government have a means to monitor these passengers? Because unlike in other countries, they're stuck in one place for 14 days. So how do you ensure that they will follow self-quarantine procedures?
We have personnel under the Epidemiology Bureau who follow up these suspected, these personnel who are requested to do home quarantine. So they monitor this personnel.
Okay, Acer, and then Raymond, Julie, and
Dr. Carlos. Here pa. Dr. Carlos, just to clarify, we have our own capacity to detect if a case is confirmed of nCoV here. But do we still have to send the sample to Australia before announcing that a patient is confirmed, even if we have our own ability to confirm the test sample?
I think I need to correct your statement. We announced, in fact, that there was a second positive even before we received the confirmatory test results, because the sample from the second positive is still being run in Australia right now. So the secretary decided that this should be announced because he was confident about our findings.
So just to clarify, we don't need to wait for the test to come back.
No more.
Australia.
No more.
Okay, thank you.
Okay, can we have?
Hi, I'm Yan from Phoenix TV Hong Kong. For Ms. Dana, does the travel ban also include Chinese citizens who may not be coming from China, Hong Kong, and Macau?
The ban specifically states that all foreign nationals who are coming from China, Hong Kong, and Macau. So we implement the directive to the letter. So if, for example, they are permanent residents of the United States, then they are not included.
What if they're Chinese citizens but not coming from China, Hong Kong, and Macau in the last 14 days?
Yeah, but they are not included if they are not. They did not come from those 3 countries, because what we are looking at is not the nationality, but where they came from. So since these are the areas that the Department of Health recommended that we implement the travel ban, the president said this directive, gave this directive to us, hence we implement it. So any foreign national, not just the Chinese, but all other nationalities, if they come from these areas of concern, then they will not be allowed to enter the country.
Thank you.
Okay, may question si Henry Uri, I think for Dr. Carlos. Ma'am, pwede po daw patanong saang hotel ang check-in? Nag-check-in sa Manila yung Wuhan couple after they get back from Dumaguete, and kumusta yung mga staff ng hotel na nakasalumuha, especially nung namatay na Chinese?
I'm sorry, I do not have such information.
Okay.
The Epidemiology Bureau staff would have the information.
Okay, thank you, Doctor. Last 2, Raymond, and then, Julie.
To Dr. Rabi. Hi, sir. Sir, just your assessment on how the Philippine government, specifically the Department of Health, reacted when there was this announcement of outbreak of nCoV, and how is DOH now acting to prevent the spread of the virus?
So I believe that the Philippine government has been responding to an evolving situation. As I mentioned, this is a new situation, it's an evolving situation, and with the emergence of disease and the emergence of more information, the government response has been proactively strengthened. We have been working very closely in guiding that response. As new evidence emerges, as I explained earlier, and as WHO classified the event as a public health emergency, the Philippine government implemented more stringent measures. This is in relation to the relative risk and the pattern of movement of people. And so we are satisfied so far with the measures being implemented by the government of the Philippines. And we are continuing to work with them to increase their preparedness in case there are further importations or there is evidence of local transmission. As I mentioned earlier, at this point of time, there are no reports of any confirmed local transmission.
Thank you very much, Dr. Rabi.
Okay, Julie?
To Dr. Carlos, you said earlier that if patients or PUIs or those practicing self-quarantine should exhibit any symptoms, they should seek medical advice. When they go to the hospitals, what kind of protocol should they expect or should they ask for? For example, should they go directly to the clinics or to the ER? Paano pong mangyayari doon? Kasi syempre pag pumili ka sa clinic ng doktor, mas marami ka pang pwedeng mahawa, di ba? Pag sa ER, ganun din naman. So, anong mga protocols po yung ipapatupad ng mga hospitals natin, particularly private hospitals which are not under the government?
We have seen private hospitals initiating their own measures to address this. In fact, there are private hospitals who establish separate triage areas to evaluate patients consulting for possible and novel coronavirus infection. I have seen tents erected in some private hospitals, separate from their regular emergency rooms, where these patients who qualify under the decision table can directly proceed, and they have dedicated personnel to attend to these patients. So that probably is the first that the person who wishes to consult should know. They should ask where, if there are a specific place in the hospital or area where they will be evaluated. And that is the same practice in the Department of Health hospitals. We have special areas for evaluating these cases.
At least for private hospitals, that's the very basic that they should do. They should have a specific area to diagnose or to
evaluate.
To evaluate those patients. And then, like, what kind of protocol should they expect? Halimbawa, kasi baka mamaya may bigla yung pasyente, bila siyang i-sanitize ng bonggang-bongga, ganun, or protective gear, whatever.
The DOH has released guidelines on preparedness and response for this particular organism, and that includes infection and prevention control guidelines. So hopefully that will be followed by everybody, because that is supposed to be implemented by all hospital facilities. And the instructions are quite clear on what to do and how to address the infection control issues.
Okay, our friend from?
Hello, ma'am. Buena Bernal from Channel News Asia. For RITM, ma'am, since the contact tracing is crucial for the containment effort, and there was a nine-day window from the date of arrival of the second confirmed case to the date that the contact tracing was done. Can we know how long is the waiting period for the test results?
It's 48 hours.
And for the surge capacity plan, ma'am, can we know the timeline and how many subnational centers there are?
There are currently 5 subnational laboratories to be upgraded. And, well, we cannot just tell them to test tomorrow. They have to be equipped in terms of facilities, reagents, and to be trained on the protocol, and to be given proficiency tests to assess whether they can perform the test properly. That's the only time that they will be allowed to do the actual sample testing.
Is there an estimated timeline, ma'am, for when they could do this?
Well, we hope it can be done very soon. But we have already drawn the plans. And as I mentioned earlier, these were subnational labs established to do influenza surveillance about 5 years ago. So the basic steps for PCR, which is the test, polymerase chain reaction, have been taught to them. But there will be some adjustments for a specific protocol on novel coronavirus.
Would you say that it's safe to say it's within this month or within the next few weeks? No.
Very hard to say.
Okay. And these 5 centers, ma'am, can we just know where they are located?
One is in Baguio General Hospital. Second is San Lazaro Hospital. Third is Lung Center. Four is Vicente Soto Hospital in Cebu. And last is Southern Philippines Medical Center in Davao.
Last question, ma'am. Can we know the cost of the testing?
Honestly, we have not costed it because we are doing it for free. But when we tried to estimate for our own information how much it will really cost, my staff estimates it to be between around 15,000 to 20,000.
Okay, thank you. Last question.
So just a quick follow-up regarding the ban of entry. What happened with the passengers coming? Are you thinking, for example, there are a lot of flights coming from Europe to the Philippines? They do a short scale in Hong Kong, maybe 1 hour. The passengers just stayed at the airport. That passengers are also banned from entry to the Philippines.
Regarding your question earlier, how many were requested for repatriation? Formerly it was 40, it's now 42. Yeah. Yeah.
Okay, thank you, media friends. Thank you to our guest, Secretary.
This is with regard to the question of Joanne. No? Joanne, you asked about who will track down those patients who are into self-quarantine. I believe that yesterday there was a discussion among the cabinet members in the cabinet thread, and Secretary Ed Año messaged this. If you'd allow me to read it. For newly arrived Filipino citizens that do not manifest symptoms, a 14-day quarantine shall be imposed inside their homes. The barangay health emergency response teams shall account and monitor concerned individuals daily, taking temperature, etc., until the end of the quarantine period. If anyone would show any symptom of coronavirus, the barangay officials will coordinate with DOF/IATF for the immediate transfer of the patient to the hospital for treatment and isolation.
Okay. Thank you, Secretary Martin. Dr. Rabi?
Thank you. I just wanted to reiterate, as I mentioned earlier, that WHO remains confident that this coronavirus outbreak can be controlled. We need the public to act rationally. WHO has provided guidelines. It is important that we don't panic unnecessarily. It's important that we maintain hand hygiene by regularly washing hands with soap and water, not touching our mouth, nose, and ears. If you have signs of respiratory infection, to wear a mask to protect other people, practice cough etiquette, maintain at least 1 meter distance from your nearest neighbors if you have a respiratory infection, and practice cough etiquette so that droplets are not spread. Ensure that all meat are properly cooked. By doing these, we are confident that based on current available evidence, this outbreak of 2019 novel coronavirus can be controlled successfully, as we have done previously with SARS and MERS. So our message is not to panic, but to act rationally and carefully.
Thank you.
Thank you.
Thank you, Dr. Rabi. Dr. Carlos?
My message is, at the moment, there is no community transmission yet of the novel coronavirus in the Philippines. We are at the containment stage, which means we are trying to prevent the virus from spreading to the community by identifying cases who can possibly have been infected. And since these are mostly from China and special administrative regions, we encourage travelers who have been exposed or had traveled to those areas to please, if requested to be home quarantined, to follow exactly the instructions. Isolate themselves in a room, wear a face mask, take your temperature twice a day. If you start experiencing symptoms, report to the hospital authorities for evaluation. We do not want family members of the returning travelers to be infected, because one family member who becomes infected can, as I showed in my slides, infect 2 or more. So 2.4 is the reproduction rate. So it can double the number of patients. If we all follow that and we practice respiratory toilet, cough etiquette, proper disposal of waste, do not just dispose waste anywhere, I think we are confident that we can remain at the stage of containment instead of progressing to mitigation. Second, let us reserve our masks to those who need them. I have seen many people wearing masks, and please think of whether use of these masks are indicated. Because now there is a current shortage of this valuable commodity, and let us give them to those who need them most, especially the health workers. And then from the DOH, at least for RITM, we are trying to do our share in identifying these cases and confirming through testing who are really infected and who are not, so that people who are test negative can be discharged from the hospital as soon as possible. We have released hotlines to the different agencies of, to the different hospitals so that they can follow the results of the test as soon as possible. And in the near future, we hope to establish more infectious disease specialty centers so that the expertise in infectious disease will be present not only in Metro Manila, but in other regions of the country. Thank you.
Thank you, Dr. Carlos. Yusek Abella.
The DFA continues to ensure the protection of nationals abroad and also to ensure the well-being of the domestic public. Also, regarding questions about the repatriation timeline, we need to remind ourselves that repatriation is subject to Chinese government's laws, including immigration and quarantine clearances. So it's not just a unilateral move. Thank you.
Okay, Sa Doval.
Good morning. The Bureau of Immigration urges everyone to refrain from unnecessary travel. Kung hindi po importante ang biyahe ninyo at hindi po kailangan, mas maigi po that we delay it, we postpone it until everything gets sorted out. Please bear with us as we are implementing measures as advised by the Department of Health. Who knows what is best for us to fight this virus? Let us also follow, sundin po natin ng maigi the recommendations of the Department of Health on sanitation, on hygiene, on how to protect ourselves, because this is for everyone's safety. Thank you very much.
Okay, Secretary Andanar.
Thank you to our guest today, Yusek Ernie Abella, spokesperson Dana Sandoval, Dr. Celia Carlos, and from the WHO, our representative here in the Philippines, Dr. Rabi Abe Yasing. Thank you so much for taking time to provide vital information to the public. I advise the public also to continue to monitor the news from the private network companies that we have here. Also, Presidential Communications Operations Office, we have a laging Handa PH page where you can continuously monitor the situation on this coronavirus. And for those who are also watching in the regions, in Region 10, Northern Mindanao, I will be there to also convene a special or emergency briefing about the coronavirus so that we can ensure our kababayans in Region 10 that the government is on top of the situation. Reminding the public also that we have an emergency meeting later with the President around 5 o'clock or 5:30 in the afternoon, and this will be open to the media afterwards. Thank you so much, Yusek Rocky. Back to you.
Yes, thank you, Secretary. Thank you, media friends. Back to our main studio sa Radyo Pilipinas and People's Television Network.
Check. Kulang. Nakukulangan kami. Check, Mike. Sa likod mo.
Sorry, sir.
4:30, sir. 4:30.